Good morning, everyone. See folks coming into the room. We have 138 participants already, and it keeps jumping up. So we have quite a few folks interested in this session.
We are recording to Facebook Live, and I'm about to hit the record button, and we will be ready to go.
Thank you, Noah. All right, good morning, everyone. My name is Judge Monique Diaz. I am your judge of the 150th District Court and your co-chair to the Collaborative Commission on Domestic Violence hosting this symposium. Welcome to our next session on reducing stigma, expanding access to care, enhancing access to treatment for domestic violence. I am here to introduce our esteemed moderator, who is our co-chair for the Healthcare Committee in the CCDV. We've had the real blessing to work with her for the last 3 years on implementing evidence-based strategies to both improve our responses to domestic violence and prevent domestic violence. Jelynne LeBlanc Jamison is the president and CEO of the Center for Healthcare Services, or CHCS, which is our local mental health authority for Bexar County. CHCS works with children and families at 35 locations around Bexar County, providing them with resources and support they need to make their lives better. CHCS's mission is to share hope and support recovery with a full spectrum of innovative services that promote healing and help people live their lives to the full potential. Ms. Jamison brings nearly 40 years of leadership experience with complex governmental organizations to her position. She previously served as the Executive Vice President and Chief Delivery Officer for CPS Energy. During her tenure with CPS, Mrs. Jamison served as the acting general manager and helped build public trust and stakeholder relationships. She reestablished a stable outlook with bond rating agencies and secured unanimous city council approval for the new rate structure. No small feat. Prior to that, Mrs. Jamison served as deputy city manager for planning and development with the city of San Antonio, with oversight over many departments. During her 24 years with the city, she helped develop economic and cultural development projects across the city, such as the development of the Alamo Dome, the 2001 expansion of the Henry B. Gonzalez Convention Center, and the renovation of the Carver Community Cultural Center. We welcome Jelynne LeBlanc Jamison, our moderator for this discussion today. Thank you.
Thank you, Judge Diaz, and thank you. It's humbling to hear that. I've been honored to serve this community for the past 40 years, and I'm still blessed. I'm even more privileged to work in the role that I work in currently, to work with such tremendous leaders such as Liza, Jensen, and Garr. I'm so privileged to have them join me this morning to talk about the very important topic of treating our families and making our community stronger. So the overall well-being of children, we all know, is tied to their mental health and their physical health. I remind those that I reach out to the community that our heads are attached to our bodies. And so there's no physical health without mental health. And there's data to support the argument that early intervention and detection of children's mental health and behavior health really promotes healthier adults. And so if we are able to early detect our children, we're able to have adults avoid long journeys of treatment ahead for them. And so joining me today are CEOs of 2 organizations that without them, CHCS would not be able to do their job because it takes a community to address our community ills. So you will hear 2 terms throughout this presentation, upstream and downstream. And I have 2 experts with me today that have been working alongside CHCS to try to take what we've learned over the years in building the system of care for crisis intervention. We're taking our best practices and all of those things that we've learned to try to create a system of care for upstream or pre-crisis services, because we really want to shift our focus into early intervention and early detection with both children and adults so that we avoid any individual having to experience crisis services. And we call ourselves the SAT Coalition, focused on reducing stigma, enhancing access to care, and enhancing access to treatment. So with that, I'm going to begin by asking Mary Garr, the CEO for Family Services, to tell us a bit about her organization and the work she does with families in our communities. Mary?
Thank you very much, Jelynne. Family Service has been in San Antonio and Bexar County since 1903, almost 120 years. It originally started to address needs around poverty in our communities with the idea that giving money to people in need would address the issues of poverty. And as we all know today, that so much tied to poverty is tied to many other things, to include the behavioral health challenges and the stresses that go with it that can impact families, family dynamics, lead to domestic violence issues, challenges in the home that become intergenerational. So over the decades, Family Service has evolved to really addressing social determinants of health needs through a trauma-informed framework, knowing that we have people that have very complex, multifaceted lives. And as Jelynne said, if you just work to address one piece of their life without understanding all the other dynamics, then you're going to be frustrated as to why you haven't, quote unquote, fixed their problem. Everything has to come together. And even though trauma can affect anyone of any socioeconomic strata, it disproportionately affects those by the folks who are in poverty and have been affected by institutional bias and systemic barriers that just cause delay after delay and problem after problem that, due to no fault of their own, they can't break through on their own, and then puts us into the challenges that we all work to address now. So that's what we work to do, not just on our own at Family Service, but with many, many partners around our communities, because none of us can address these issues on our own. We all bring our strengths and our challenges as well to finding how can we integrate and comprehensively support our families so that we can break these intergenerational cycles of domestic violence, substance abuse, poverty, et cetera, et cetera.
Absolutely. So before I begin my questions, I'd like to give an opportunity to Liza Jensen, the CEO of Alpha Home, to share a bit about her organization and their role in servicing our community. Good morning, Liza.
Good morning. Thank you, Jelynne, Mary, and Judge for having me this morning. In sharing Alpha Home organization, we have been in the San Antonio community for 56 years, and our focus is to work with individuals who have addiction needs. We have a 47-bed women's residential treatment program where women who want to obtain sobriety, maintain it, and in some cases reconcile with children that may be in foster care, spend anywhere from 75 to 90 days with us. We also have a recovery coach peer support program and an outpatient program for men and women in addiction. How we fit into this model, and picking up what Jelynne said earlier, it takes a village to raise and help people move from where they're at to a better future, is that we know with domestic violence, there's a high correlation between substance use and domestic violence. And so it's one of those things that we have to take a look at both of them to ensure that people have the most successful outcomes possible. At Alpha Home, when people are in our residential treatment program, they receive 10 hours of individual counseling or family counseling a week. They receive 10 groups. Each group is 2.5 hours, and then they receive 10 hours of recovery education, like what are my triggers and what's my self-talk that justifies my continued use, what's the motivation for me to maintain sobriety. And so we're part of the coalition because we recognize that we need to do a better job of coordinating with our other nonprofits so that we're all aligned in the same direction. And that's one of the things that I think that the San Antonio Coalition has done a good job, is bringing people to the table to see about heading with the priorities that we need to do as a city and how each agency can work together to help support initiatives.
Great. Well, I think both of you have done a great job this morning in setting the framework for why early intervention and pre-crisis services are so important, or the upstream work is so important in the work that we all provide. So Mary, tell us, what is family services witnessing and experiencing as it relates to domestic violence in our community?
So specific to domestic violence, we see the gamut. We see families, a lot of moms, some men, and then also children affected by dynamics in the home that could be tied to verbal and emotional abuse, but all the way up to where we have gunshots in the home and people injured or killed, and a lot in between as well. And so when we work on that, on the lower end, it's how to help the individuals and the families, especially usually the moms, about how to cope, how to stand on their own 2 feet, how to develop some independence and everything. And when we think about it, I'll give one example of a client that we had, but she's typical of so many that we see in our community. She was a non-working mom, left an abusive relationship, which in and of itself takes an extreme amount of courage. It's very hard to do so for so many reasons that many of you in the audience know. So we were able to one, help her with the emergency services, find her, temporary housing and supports and everything, financial support. But then with that, for that longer term piece, we linked her with our financial empowerment center, and they were able to help her be able to start job training. They were able to help her be able to move into permanent housing. They were able to also help her with counseling, behavioral counseling that she needed for herself and also for her children, because, it's working with on the children, how to have those appropriate conversations at those different age levels to help them understand, what's going on. For the mom, it's helping to build, the self-esteem and helping to build that confidence that they can be okay on their own and in life and be there for their children and be strong parents and create a strong family dynamic for their children, give her the independence, that feeling that she can do so on her own. And then also, just as importantly, helping her to understand what should a successful relationship look like in the future, so she doesn't continue in that habit of potentially going back into another relationship with somebody that will continue the same type of abuse that she just escaped. And unfortunately, as we know, and the research shows that, if a girl is growing up in a home where she sees her mother regularly abused by, the father, boyfriends, whoever, then without the supports and understanding, that girl can grow into a woman to become in relationships where she herself becomes a future victim. And if a boy is growing up in that dynamic where he sees his mom regularly abused, he also is more highly predicted to become an abuser in future relationships as an adult himself. So we have to not just work with the mom, but helping those children develop those coping skills and understandings so we can break that intergenerational cycle of domestic violence. So we do all of that in our work. And then any of the other aspects that, we have with our social determinants of health programs that can assist that family, because they're not just breaking that cycle, but again, often it could be tied to poverty. And as you noted, the substance abuse connection and the challenges with lack of access to high quality education, which then leads to the ability to finish school and go on to workforce development, college, career, et cetera, and have strong, healthy relationships and families going forward.
It's such a complex system, and I'm sure I'm going to transition now to Liza, as their primary population are adult women. And so, Liza, what does your organization witness from the population that you serve in terms of what we're seeing with domestic violence?
I think there's a couple of things that it's important to highlight. The first is that the impact that COVID has actually had on the need for services. For example, in 2021, SAPD received over 71,000 family violence calls. And of those, incident reports were filed for about 20,000 of them. And so that's about a 5% increase over the previous year calls, and about a 20% increase in family violence reports filed pre-COVID. And that's important to note because I think as all of us have gone through the pandemic, we had quarantines and we had isolations, we had kids not going to school. And so with that, we not only saw the jumps in the family violence, but we also saw it in request for addiction and treatment. And it makes sense when you got no place to go because the city has closed down. And plus now you've got trying to work at home and then trying to manage the kids' schoolwork. And so those are the type of increase in trends that we have seen in our area. One of the things that Alpha Home does is that we get about 40% of the women referred to us are actually being referred by the courts because their children, one or more of their children have been removed from the home and they're in foster care. And so what we do is we try to align the programming so that those mothers receive certificates in seeking safety, which is a trauma-informed care. And it's designed, like Mary was talking about, to kind of stop the generational cycle of what's happening and build a better future for those kids. We also have a violence class, and then we also have a parenting class. And the hope with that is that if the mother, while they're engaged in our programming, is successful, that there can ultimately be, if appropriate, a family reunification. I think the other thing that's important that ties into domestic violence, many times some of the women that come to Alpha Home seeking treatment literally are coming out of a domestic violence situation with only the clothes on their back. So a lot of what we're doing is to help them build their social life, change their living conditions, get engaged with a sponsor, a peer recovery coach that will help them address their social determinants of health. And so while they're spending that time for them, what we hope is by the time that they've completed the program, that we've been able to have transitional living housing set up for them, that they're on the road to, once they get secure housing, to possibly reunify with their kids in foster care. And throughout all of that, our goal is really to ensure that they have the resources necessary to stay engaged in treatment. I read a JAMA article about 6 months ago, and it was asking the question about why do people drop out of treatment? And it was kind of interesting because they surveyed the treatment folks and they had their answers of why they thought people left. And then they surveyed the clients. And what the clients said is that the top 2 reasons that they dropped out of treatment was not having the family support, the relationships. And the second thing was not being integrated in the program. So we try and address those needs by making sure they've got a peer coach, they've got a sponsor. We have an alumni program here of individual women who have graduated from our program, and they stay connected with an AA group on campus, and they become mentors or big sisters to the clients who are in treatment now. The whole point of that is that we know for some of the individuals that are coming out of domestic violence, they may not be going home. They may not have the relationships that are healthy enough to keep them engaged on the path that they're setting. And more importantly, that they need to have people around them to encourage them when the going gets tough. And so those are some of the things that we offer to make sure that the clients that we're working with stay engaged and get the treatment they need from domestic violence case managers and networking with those organizations in the family violence setting to be able to ensure that they focus on maintaining their sobriety.
I'm so proud of the work that this community has undertaken in the last 3 to 4 years related to trauma-informed care. We now have several organizations that are certified in providing that training. And now we have organizations that are certified as trauma-informed care organizations. And I think it really means so much. It goes to the heart of success of really addressing the issues in our community. And so kudos to both of you, because both of your organizations have taken that on. and you're providing that level of care, and it really makes a difference at the end of the day. Can you share with the audience some other avenues that we're taking to move our community upstream in this area and prevent violence in our community? Mary, I'll go back to you.
Yeah, if you don't mind, because I don't know how many in the audience really understand upstream versus downstream. Do you mind if I give some context to that? And I have a couple of slides I can quickly show. All right, so I'm going to share my screen now. And I'll just kind of talk through some of that. Can you all see that? Okay, so first off, just to give some background on downstream versus upstream. Upstream is where we really want to be. That's what we can do upfront with decisions, laws, ordinances, etc., policies, actions, influences that can help create positive outcomes to prevent, in this case, domestic violence, etc. Downstream is what too many of us deal with on a daily basis, and that's what's already happened in someone's life that has created either the opportunities or far too often the barriers and the challenges that are now affecting their long-term health, their social relationships, potentially even early mortality. And that's where we want to try to influence, and that's where we talk about breaking intergenerational cycles, but also addressing effects that have already happened in people's lives today, and how do we help them moving forward in that upstream. So with that, when you think about the impact of health, and as Jelynne said, you can't separate your head from your body. Physical and mental health are aligned, but it's also, that broader spectrum of health. There's social, emotional health. There is financial health, which underpins a lot of domestic violence situations from a control perspective. There's environmental, occupational health, spiritual health, etc. And we really talk about health of individuals, families, and communities. Because when we have domestic violence in a family, it's not only affecting the individuals in that family, it really affects our entire community, and we've got to move beyond it. So we have a lot of challenges where we invest so much in the downstream space after bad things have occurred, as opposed to how do we invest up front. And that's what, they talk about, those social services, which is really the upstream health. And I'll just throw out a statistics. In general, the United States, for every dollar we spend on health care, we spend only about 90 cents on that upstream or social services support area. Other developed countries, peer countries that have a much higher health status, for every dollar they spend on actual health care, they tend to spend about $2 upfront investing in the upstream health space. So we have to really work better to move our investment into upstream prevention areas and keeping people healthy. And that includes in the social pieces that link to domestic violence and everything else, as well as, understanding that downstream investment that is currently occurring. So social determinants of health that you've heard all three of us mentioning so far, those are those conditions and environments where people are born, raised, live, work, play, and age that either prevent opportunities to be happy, healthy, and successful in life, or they put in barriers for them. And these are just a few of the examples that you see. And again, tying to today's panel, we see this too often, but it's all linked together. So what we want to look at is what can we do in these spaces using this is the Healthy People model through Department of Health and Human Services to help in these areas to be able to create happy, healthy, stable, successful families that don't then, put into places, domestic violence, substance abuse, and all sorts of family discord. And this is where we want to be. So this, Jelynne, gets back to your comment about where do we want to see the space happening? If we can create these opportunities under these different pillars, this starts to take away some of the stresses that we see far too often in family dynamics that lead to some of the domestic violence that we see. Domestic violence is a symptom. Substance abuse is a symptom. A lot of them are tied to the toxic challenges, the barriers in their lives that all link together, overlaying it that many of them have been exposed to a lot of trauma in their lives as children that they carry into adulthood that now occurs in their own children, and the cycle continues. This is what we want to be working to break. And when you're thinking about upstream health, You can focus on the health and healthcare piece from the behavioral health standpoint, that this column here, but really, all of these interrelate. If we can't help people across this spectrum, across these pillars, they will continue to struggle. And yes, some people, they can manage on their own, but many folks who are caught up in these intergenerational cycles of poverty and everything that goes with it, they then are carrying these on, and they need that help to be able to even know what is a normal, what is a better normal out there, that they don't have to think that it's okay to have your partner beating you up or to yell and scream at you and beat up your child. In some areas, they think that's okay. We have to be able to show that, no, there is a better way to live and a better way to be happy and healthy. Because when you look at this kind of information here, you look at a child with supports, a child without supports, and a child that's growing up in a household with domestic violence going on and family violence, and without all those supports, more likely to end up on this bottom path here. A child that is supported, that we can help, that generally the mother, sometimes the dad, but generally the mother, can help that mother and child to overcome those barriers. More likely with those supports, we can break those cycles here. Because at the end of the day, as I said already, when we have, challenges within the family dynamic that affects the whole community, we've got to support our community by moving away from toxic households and communities into thriving families and communities. And I'll stop sharing now.
No, I think that was great, Mary. And you really placed a lot of context on the next question. So those are all goals for the communities that, if I looked at mission statements across this community, all of us have targeted on the quality of life for Bexar County and enhancing the quality of life for Bexar County. So, Liza, I'm going to ask you, share with the audience, what are some things that we are missing in our community to achieve the upstream goals that Mary has shared with us?
Well, certainly we've got some really good things in the community, like education prevention that Mary mentioned. We certainly have other things like the hotline, and the YWCA does education in the schools. And of course, the courts remove kids that are at risk in terms of that. One of the things that I think that is important when we start breaking down what happens in the families that leads to some of the reactive services that Mary was talking about, are that we've got to be teaching concepts like decision-making skills, being able to talk about assertive communication, and being able to discuss concepts like boundaries with that. And one of the things that Mary had talked about is that kind of intergenerational type of what's the mother doing and what's happening with the kids. And so for a lot of the childhood trauma that we see, it perpetrates because there is a lack of communication. In other words, it's secrecy that's going on. That's familiar, that they've seen. They think that's normal, that, that it's okay for one parent to hit the other parent, and that's familiar to them. So when they get to the point where they start having relationships, that's what they're comfortable with, but that doesn't mean that it's healthy or the right way. So I think some of the things in terms of where we need to go is tying our unification with our mission statements for agencies, all in the same direction, and having the same points that we're giving the same message. The ability to do education in the schools, for example, is an initiative that's very good, but we've got so many different school districts here in San Antonio, and part of that is the funding available to all of them with the same sort of message, the same sort of resource list that's out there, and giving that type of support so that we have the proactive education that's out there in the churches with youth groups, in the schools, making sure that PTA is aware of it. And so really what I think is missing is that unifying message and making sure that there is equitable resources to cover that proactive education throughout the city. And again, you've got some organizations that are in maybe one or two schools. You've got some organizations that are limited by financial resources. But I think all of that unifying message, the collaterals that are the same. So again, the same message is out there, the same resources that are out there is critical to being more proactive instead of reactive, where we're spending the healthcare dollars on getting somebody sober and doing some of those things.
So you hit the nail on the head, and I'm probably going to get in trouble when I say this, but I love you've certainly hit a very poignant point with the number of school districts, the number of leadership issues that come out of those school districts, the different approaches, trying to be upstream and trying to coordinate all of those messages it's a heavy lift. It's absolutely needed, but it is absolutely a heavy lift for not only this community, but all communities. And I would be remiss if I didn't say our current political environment is certainly not promoting a unifying message. So just remember that when you guys go out and vote. I'm probably going to get in trouble, but that's okay. I'm old enough now.
Jelynne, could I add to some of this as well?
Sure.
And I agree completely. Unfortunately, there's so much polarizing talk out there, and frankly, a lot of misinformation, disinformation that, it's hard for many folks, even those who are highly educated, to understand, what is accurate, what's not.
Yeah.
And so, that makes it harder for folks that are going through challenges in their lives. But back to Lisa's comments, when you're thinking about where can you help to focus, you have your school-based awareness, and then we also have our community awareness as well. And, where is it that people are likely to see information? Because they're generally not going to seek it out, especially if they're in the middle of this and, when they're thinking that things are normalized and stuff. And so how do we work to build more community awareness and education in terms that will resonate across, different stakeholders, communities, bringing in the cultural dynamics, et cetera. And as also Lisa noted, when it's normalized within a family, if you think that's your normal, you may not realize that's not really the mainstream community normal, and it shouldn't have to be that way. And we also know that so much of this is taboo, even if it's going on in a home and it's not right. You're conditioned to not talk about it because you don't want to bring shame on yourself, the family, etc. So how do you, bring that out, saying that it's okay to approach somebody and ask for help? And too often also, that a lot of people say when they see it on, TV, when there's, another domestic violence tragedy and, people being arrested, for domestic violence, etc. They're always assuming that's happening to somebody else, somebody they don't know, or someplace else, but not any of their family or friends, and not in their neighborhoods, not realizing that sometimes it is people they know or within their family or within their neighborhood and community. So they don't always appreciate that it can hit very close to home. And so we also know, and going back to some of the pandemic, a lot of things have switched to telehealth, but so much of this too, you can't see certain things via telehealth.
Yeah.
So I know here at Family Service, I know Lisa, with your work, we never could shut down, and we never could just shift to telehealth. We did some because that's what, clients needed, but we had to continue to work face to face, because that's where we build those trusting relationships. That's also where we can see things happening, and where people can then start to feel comfortable to open up and share things that are very personal and very, for them, shameful and humiliating, but helping them understand it's not their fault. And there are ways that they can be helped when they're ready to receive that help and move forward. So all of that needs to be, considered. Outreach in the schools, absolutely critical. Things about, teen dating, teen violence, human trafficking, and all the grooming online, and all of the stuff that we know is going on, and knowing what's happening, just in Texas, but across other states too. But outside the schools, as I mentioned, community opportunities, the Kids Day in the parks have been nice events, but have more opportunities for that, but opportunities across all quadrants of our city, across our zip codes, and looking at where do people go. Lisa mentioned faith-based organizations, but, people shop. But not everybody's shopping at HEB. They can't afford it. Maybe they're going to Dollar General, or the corner convenience store because they don't have transportation. Are they using the bus system? Can you put more things on the buses, to be able to advertise things, but in a way that people will see it out there and then start realizing maybe it does apply to me. Maybe this is something that can help me, or can help my mom. who's going through this, and I'm tired of living in this environment at home, or maybe a neighbor or a family member could say, I could potentially help in this situation. So that's what we have to do to build that consistent message, Jelynne, as you said, and find ways to bring us together more collaboratively and help to align those messages. South Texas Trauma Informed Care Consortium is one of those avenues, working on certification for being trauma informed, but really should do more in that bigger space. And I think you're leading the way on that as well, but also across social determinants of health. And we have an effort now where we're trying to create a social determinants of health consortium across sectors in our community to help understand what's being done, what are the gaps out there, how can we align strategy and messaging so we can start investing upfront in the upstream as opposed to spending so much more in the downstream. And I'll just give one other quick message. We spend more per day for a person incarcerated in our prison systems in the US than we do per day on each child in our public school system. That's upstream versus downstream. That's totally backwards. We don't want to be working to keep people in prison. We want to find ways to help people grow up and never go into prison. That's what we have to be thinking about as just one example.
I'll share some things that we're doing at CHCS. Our foundation has taken on an initiative for the past 2 years, and we are hoping to educate this community on mental health first aid. And we have a variety of courses. We can certify individuals in mental health first aid, or we can provide an overview of mental health first aid. And what it simply is an explanation of the disease and removing the myth that it is elective for people to have behavioral health or mental health or substance use disorders. We equip them with the accurate terminology, how to talk about the disease, and how to help people receive or connect with services. And we just feel like this is our best contribution to this community to help the general public, organizations, companies, teachers on mental health first aid. The curriculum has been advanced recently to include teens, and we're very excited about the work we're doing with the city of San Antonio and their Project Worth. And we hope to expand that to student leaders throughout our variety of school districts so that that leadership group at the school level can then be equipped with the appropriate terminology and a way to encourage their student, their friends to seek help. And it's okay to reduce the stigma associated. So I'm hoping that we will continue, we're always looking for funding, but continue to provide that service to the community because we think it is so needed, along with certifying the community in trauma-informed care. It seems very simple, but a great first place to start is just simply asking what happened to you, to really understand how we best help our families. So I'm going to remind our participants, they can place a question in the chat. We have a few more minutes. I'd like to leave at least 5 minutes to answer any questions from our participants. So please place your question in the chat and I'll try to multitask, and I'm going to ask our panelists one more question and look for questions in the chat. So both of you have been very involved in our recent work on creating the SAT Coalition. And while it's not the panacea, it's certainly just one more opportunity to create upstream connection and collaboration to help this community. But give our participants a view in terms of what you believe the SAT Coalition can continue to do to address the stigma that remains in our community and enhance access to care and treatment. Liza, I'll start with you.
Sure, absolutely. I think one of the important things that we need to focus with the SAT Coalition relates to something you mentioned earlier, which is the myths. For a lot of these situations, whether it's family violence or whether it's addiction, there's a lot of myths out there that are believed, and they're not always accurate. And so not just saying that campaigns that it's okay to say, to actually talk about it. But a good example is a lot of the stigma that people who have an addiction face is, oh, you brought it on yourself. You chose to be an addict. You know, why should we spend dollars? Yeah, exactly. And so I think one of the things that happens with that is that, number one, to Mary's point earlier, you know, something like addiction and domestic violence, they affect every race, socioeconomic status, and whether you're in church or not in church, it could be happening to you or somebody that you know. And I think that's critical. One of the things that I know in the addiction community is that people just automatically assume that addicts are, you know, engaged in criminal behavior to get their next fix. And they don't recognize that this is the high school athlete that got hurt in a sport, and now they've been in rehab and they've gotten addicted to a painkiller of some sort. They don't recognize that the woman that has had chemotherapy because of stage 4 breast cancer is taking pain medications. And as they go through those type of life events, the end result is that they become hooked on prescription medications. You know, from the domestic violence, well, you know, if it was that bad, why didn't she just leave the man from the home? And so stigma like that, not recognizing that there's not just a black and white, one size fits all, but rather that each individual has their own story, their own situation, and regardless of where they're at, they still need the help moving to treatment, moving to a safe environment, and being able to feel safe enough that they can reach out to make changes in their life that they need to make with the right support system. So I think that's critical. I also think from the SAT Coalition, my background is 35 years in mental health. And so one of the things that we have in our community is that the mental health network is very well developed, from the STRAC component, from the organizations working together, from the things that are happening with MedCom, but the addiction community is not as engaged. I think the addiction community is very close within our ranks, but if somebody doesn't know that you go to RISE for youth and young adult, if you're looking at men's residential, you go to Lifetime. If it's women, Alpha Home, and some of the services that we have, we're not fully integrated with the rest of the system. And so I think that's certainly important to take a look at and move forward with.
That's great. Mary?
So Jelynne, I think too often what we've seen in this sector, unfortunately, because this is where the need has been, is working in that downstream space, working with people who have already been affected for so long and now are trying to address, you know, their needs and how to move forward at whatever level. That's all downstream. So the SAT Coalition, I know what you're working on is trying to bring together entities that understand that work absolutely has to continue, but at the same time understanding that we can't afford to only just work in the downstream. We have to have the resources to be able to prevent and to mitigate and to break that intergenerational cycle. And we can only do that when we come together and understand what is that upstream space, what could that be to be able to prevent, mitigate, move forward, break those cycles. And that's where we all have to work together, as I'd said earlier, with our strengths and our, you know, expertise and across all of our different organizations, because we've all come to it from a slightly different perspective, working in this space, unfortunately, as we know, in the downstream, but also in the upstream. And so how do we, you know, do that blending? But if we have the SAT Coalition identifying that upstream, that's where we start to move the needle. And it's going to be a slow needle because we're talking generational change. And unfortunately, too many of the funding sources, you know, want quick wins or want, you know, something resolved within that budget cycle. And it's very hard to get the longitudinal research to show what is and isn't working over a longer period of time. But that's really that public health need. That's the upstream health that says, okay, what is a root cause for domestic violence, which is different, we know, for so many families, but there's still some themes that carry through. So understanding that, and then understanding, as we talked about, with the education, the awareness, and how can we all bring together where we work as part of the SAT coalition to move it forward on that broader voice. When we all work individually, we're one voice representing those who generally don't have a voice. When we come together as a larger group, we're a bigger voice representing a larger population that is affected by this. So that's where I think, we're going to see a lot of value too, to help be that bigger voice to all those that have the ability to provide the resources to be able to make change happen.
So I see one question in the chat for your slides, and I think we can make those available if that's okay with you, Mary.
Those slides were just a few from a larger set of presentations that I give. So I generally don't just share those out of context, but I can work to do something for whoever asked for it, or even give a presentation on social determinants of health and trauma-informed care, which I do in various other forums.
We'll grab the individual's name who requested and link the two of you so that they can see that additional information. And then there's a request for the website for SAT Coalition. And we're not that fancy yet, but you can certainly contact any one of our organizations and we could connect you with the work that we're doing as an organization. We are seeking support from Bexar County and the city of San Antonio to formally create the organization of SAT Coalition and to assist us continue. But it's been ad hoc. It's been through the grace of all of these leaders coming together to continue or to initiate the collaborative discussion and identify the needs in the community to form this coalition. So I do want to take the time to acknowledge the work that or the investment recently by Bexar County as well as the city of San Antonio in both the domestic violence space as well as mental health and behavioral health and just supporting families generally. I think everyone came out of COVID really understanding the need in this community. And one thing, if there's one positive we can say out of COVID is that we're all talking about how COVID impacted all of our mental wellness in this community. And so we are having a better community dialogue about it. And we have seen some increased investments from both of those governmental entities. I don't see any other questions. Oh, I do. So there's a question of accepting private citizens, volunteers to assist in the SAT Coalition. And I would say generally, yes. We're going to need an all of the above strategy to make this happen. So please reach out to us. And I'm looking for any other questions. While I continue to monitor our chat, we have an upcoming legislative session that will be starting in January. What's on your radar to identify as a need from our legislative delegation as they come together in Austin in January for the next fiscal year? Liza, I'll start with you.
There are several things that we're currently taking a look at that I think are important. And part of that is making sure that the legislators fund the education programs that we need in our community that deal with topics like domestic violence, with children, with substance abuse. And I think that's important to take a look at. Other things that are important is that we have a workforce shortage right now. It is extremely competitive to be able to get licensed chemical dependency counselors and also direct care staff. And so we're hoping that we can get some traction in terms of taking care of that. With the increases that we've been seeing because of COVID in the area of substance abuse, it's been very challenging to meet our goals without having the trained staff that we need to be able to fulfill our obligations. Other things that we're taking a look at is legislation that we can do to help support making things easier in the community. And off the top of my head, one of the ones that has been brought up through previous legislative sessions is the ability for emergency room physicians to initiate the emergency detention. That has actually come very close and didn't pass. That's critical because our rules allow for law enforcement officers to initiate an emergency detention, and then the physician is the one that has to evaluate the client and then determine if it can be lifted or not. But we actually use a lot of resources by not allowing the physicians who are doing the evaluation, if they've got somebody in their ER to initiate it, or somebody in their care that they perceive as a danger to themselves or others. So I think it's things like that, focusing on what would make it easier to get the client where they need to go in a timely manner without putting barriers that, frankly, in my opinion, just don't make sense.
No, that's very important. I remember when I started this work, Dr. Sally Taylor with UHS was a constant reminder. We have got to get people in with the right care at the right time.
Exactly.
So that's really been a focus. It's absolutely necessary. Mary, what are you looking forward to in this upcoming legislative session?
You know, I think everything that Lisa said in this space is spot on. And, you know, there's more on that. We work in a lot of different programs across the different, you know, social mental health pillars, as you know. So we're working with the youth, you know, space and all the things around what happened in Uvalde, which has a lot of underpinnings and some probably tied to even this conversation. But I would say I'd really almost turn it back to our audience today. And one of the things that, you know, we've been reminded of is that, you know, interestingly, with one of the few silver linings of this pandemic is that our state legislature is going to be starting this upcoming session with more funds than they've had quite a while.
Yeah.
So this really is the time, you know, and they're winding down, trying to put together future upcoming bill opportunities. So if you all are engaged in advocacy, now is the time to be working with your legislators in terms of what do you see as needs in your respective communities that you want to see addressed, and help inform them as they're trying to flush out their bills in ways that will support the work that you're doing and support the families and individuals that you're trying to help in your respective communities. This is really our time to do it, because we may not have this kind of, I hate to say, windfall for quite a while. And this time is going to start very, very soon. And then that session will be over, and you may not get that chance again for a while. But a lot of work in the legislature is helping to inform not just our legislative representatives, but a lot of times the staffers who are doing really the bulk of the work, to really understand what you're doing, why it's important, and how they need to engage. Because domestic violence, it crosses political parties, you know, and needs to ways to address it. Sometimes they might have that lens on, but nobody wants to see somebody, you know, die or be injured, or children adversely affected because of domestic and the violence in the home that could be prevented. So what do you want to see done that the legislature, the state legislature, can support for you in your work to help, you know, us address these really, really important issues?
You're absolutely correct. Everything we've talked about today knows no political party affiliation, so it impacts all of us. And they will be establishing a 2-year budget. So it's absolutely imperative that all of us are targeting and talking with our legislative delegations, because we all know what 2 years can mean to this community. We've all experienced it. And so with this windfall, we need to help them direct it to the resources we need. There is a comment in the chat regarding participants who are in the parenting classes and the domestic violence classes. And one of the issues that they ask for is that these issues are taught in both middle school and high school. And so one of our legislative priorities for CHCS will be to educate our legislators and ask them to make mental health first aid a requirement for all of our educators statewide, so that all of our teachers have a better understanding and they are equipped with the correct terminology and can help identify and help parents or help kids or help the student leaders at their schools with directing to the right services. And the other areas we would like to see more funding pointed toward educating our team leaders on mental health first aid for teens, because there is a specific curriculum that's brand new for them. So if there's anyone who would like to support that initiative along with us, you're more than welcome to contact our VP for intergovernmental. I'm sure she would, Allison Greer, she would be excited to have to enhance our stakeholder group to support those messages. There's also a question about how to, what are the volunteer opportunities for all of our organizations? And so I've asked Leonard Rodriguez with the CHCS Foundation to contact that individual and share information about all of our organizations. So Mary and Liza, there may be some folks following up trying to find out how to volunteer with your organization. So he will.
And Jelynne, I would suspect most nonprofits, if you go to their websites, they generally have a volunteer tab or button, or a contact us, and you could just reach out directly to any of them or us.
Great.
We're always looking for volunteers.
Yes, we are. Let's see. Someone wants Mary to run for any office that they would have her vote. She would have my vote too.
Thank you.
See. No, I thought that was great. Let's see. There's a question, and I think Lisa, you mentioned the 71,000 calls from with SAPD in 2021. They're asking for any updates in 2020. Do you have the data from 2020?
I have it on my looking it up, but the information is connected to your website, and it comes from the Collaborative Commission on Domestic Violence, and this is their 2021 annual statistic report. And one of the things, if you haven't gotten this document, to go ahead and get it. It's I don't know, it's got about 40 pages or so with it, but it's got key findings, not just from 211, but it also includes the sheriff. It includes the Southwest Texas Regional Advisory Board. In the police department was the section I referenced. The sheriff, a lot of other things like the Family Violence Prevention Services. And so it's about the data that all of these different organizations, the district attorney's office, have collected about family violence. And it shows you from their perspective what the problem of family violence looks like. So really, I encourage you to take a look at it, because again, this is one of the things that we were talking about. Each organization has their specific focus, and taking a look at that and taking a look at the data that they collect, and they all add something unique to the situation of domestic violence.
Great, thank you. Thanks for referencing the annual report. I was going to do that at the end, so thank you for that. There's an additional question about how the SAT Coalition is different from the CCDV. And really the work is interrelated. The SAT Coalition are organizations that provide treatment, access to care, access to social determinants of health issues. But really the focus is to educate on the stigma and how to reduce the stigma associated with behavioral health, mental health, or substance use diagnosis or disorders. It's also to make connections on access to care. So if someone is impacted by any social determinant of health, it's a way to connect them to those services. And it's also an effort to have organizations so that we can expand access to treatment. Not all of us can treat the entire community that's in need of these services. If you follow the conventional wisdom of the country that 1 in 5 individuals have experience with mental health or behavioral health or substance use disorders, that would mean a community of 2 million that we have here in Bexar County. We have approximately, or a little over 400,000 individuals who could have an experience with any one of those disorders. The CHCS can see only 38,000 a year. So to put that in context, and there's so many other organizations that have limitations based on their capacity, either through workforce or funding. So the need is there and the gaps are there. And our goal with the SAT Coalition is to bridge those gaps and see how we can help each other in all three of those areas: reducing stigma, enhancing access to care, and enhancing access to treatment. Now, we are very much connected to the work that the CCDV does, because many of those individuals that are experiencing impacts of domestic violence, whether it be the victim or the individual perpetuating the violence, sometimes they are in need of substance use treatment. And so we very much are linked or aligned with the work that the CCDV does. There are two different organizations, but there are many faces that are on both, and we try to stay connected to the work that both are doing. So I hope I've addressed the question that came forward in the chat.
I don't mean to interrupt everybody, but we are out of time for this session.
Oh, okay, Noah. Well, I want to thank our panelists and thank all of our participants, both in the webinar as well as on Facebook. And as Mary indicated before, all of us have individual websites that provide more information on the organization. But if you want more information on the SAT Coalition, you can also contact any one of us, and we'd be more than happy to help you join us. Thanks so much for Judge Diaz asking us to participate. She's doing amazing work.
Thank you.
Goodbye, everyone.